Good morning, my microbiome nerds, fellow friends in the field. Today is August the 13th, Thursday, and it's 83 days to the defining election of our time. And today we're going to discuss bacteria in our gut that couple and uncouple components that are very important to our metabolism. So first of all, know that these bacteria, on one hand, there are certain types that will couple amino acids, fats, and proteins and other nutrients that we need to help with absorption and metabolization. And then there is another group of bacteria that uncouple components such as estrogen and bile salts. And in some cases, we need them as well. These bacteria work in our gut to give us what we need in times of different situations in our life. If we are needing more nutrients or needing more of a substance, the couplers and uncouplers will work to provide an environment that works for them and works for us. But there are times when these uncouplers can be in a high enough ratio that will start causing issues for us. For instance, if they're uncoupling too much estrogen, then the estrogen is going to recycle, be reabsorbed, and create a situation called estrogen dominance. Estrogen dominance can lead to a lot of symptoms and issues and conditions. PCOS, polycystic ovarian, or menopausal issues, or cardiovascular issues of clotting. So there's a whole cascade of symptoms that can arise from estrogen dominance. The other component that can be uncoupled is bile salts. And bile salts in your liver will have an affinity to toxins, and then they go through your colon, and they should be removed from your body. But if these undesirable situation where dysbiotic organisms, that is, these bacteria are out of ratio, they're at a high enough ratio that they are unconjugating too much bile salt, they're causing those toxins to recycle, and then we reabsorb the toxins. And there are many symptoms that go along with the increase of toxins, and what we would refer to as a Herxheimer reaction or a die-off reaction can be confused with just recycling of toxins because our elimination pathways are not working properly. Now, what conditions will set the stage for these different groups of bacteria to be uncoupling too much or coupling too much or not enough? Those are some things that we will explore in future nerd meetings. So next week, please join us. We will have a guest speaker. And I do want to then put out the prayer for all of the practitioners that are working with individuals and their metabolisms and their conditions and their gut bacteria that create situations and symptoms that cause pain and suffering and psychological issues, especially anxiety and depression during these times. So we pray for guidance for all of our practitioners, that they will be given the direction and the help and the instruction in order to help the many patients and clients that they are responsible for and they are helping. Thank you.